Okay, so next up is Dr. Peter Merkel and Dr. Jen Gordon. So I'll just turn it over to you all.
Well, great. We'll introduce ourselves. Jen, why don't you start?
Sure. I'm Jen Gordon. I am co-principal investigator of the VPPRN. I'm an eGPA patient. I was diagnosed in 2014. I am also on a patient partner with the eGPA registry, and I'm co-host of the third Thursday eGPA Zoom chat. Good to be here.
Ms. Young.
Hi, my name is Christine Young. I am the new network manager of the Vasculitis Patient Powered Research Network. I started back in October of last year, and then obviously the newest member, taking over the role of the network manager from Kaylin Young. So she's left very large shoes for me to fill, which hopefully I can do as good a job as she did in this role. And I'm excited to be part of the network. I'm excited to work with patients. I'm excited to work to advance research to improve the quality of life for all patients with vasculitis.
And I'm Dr. Peter Merkel. I'm a chief of rheumatology and professor of medicine and epidemiology at the University of Pennsylvania, where I run our vasculitis program. I'm the principal investigator of the Vasculitis Clinical Research Consortium and International Research Network, and the co-principal investigator with Dr. Gordon on the Vasculitis Patient Powered Research Network. And I've had the privilege to be working with and being physician to patients with vasculitis and studying vasculitis for almost 30 years. And I've been a member and part of the Vasculitis Foundation for that long as well. And today we are going to give you an update on the work of the Vasculitis Patient Powered Research Network. So I'll share my screen. So we're going to talk to you about the Vasculitis Patient Powered Research Network. You've already met us. That you can see us live. That's what we look like when we're smiling at the camera. Jen, why don't you lead us off, please?
Sure. So the mission of the VPPRN is to answer questions that are most important to patients living with vasculitis. It's a very broad network. We're going to walk you through a few slides with an overview. The VPPRN was started in 2014, and we have over 3,800 patients currently in 23 studies and 13 different types of vasculitis, and we're going to continue to grow this.
We are extremely grateful and wanted to highlight two people that helped build this network for us and with us. First is Diane Shaw, who many of you know, past president and important person in the Vasculitis Foundation, and she was our co-principal investigator for some time as patient partner with me, and was really fundamental in helping us grow. And Kaylin Larson, who you also may have known, her name, she's back to Kaylin Larson, and she has helped build it from the very beginning and has been an important part of building the network. I'm happy to say that she continues to be an important part of the Vasculitis Patient Powered Research Network as part of her full-time position at the Vasculitis Foundation. So we're going to talk about our research capacity. We have, forget who's who, but I think it's me. We have the Vasculitis Patient Powered Research Network has grown steadily and I think fairly remarkably. We have nearly 4,000 patients and growing, and we very much want to continue to grow, as we'll show you how and why. They're from 80 plus countries. This is all forms of vasculitis. We collect data about your disease and the manifestations and signs and symptoms of your disease when you first were diagnosed and over time. And we also collect how you feel, your symptoms, etc. You saw Dr. Kornick talked about patient-reported outcomes and SF-36, and we collect similar data to get a sense of how people are feeling with their disease, both related to your vasculitis and related to your health in general. And we are a collaboration, and this is a key part that we keep emphasizing, of patients and investigators, and quite a large community of patients and investigators that are helping to advance research.
We have a global network around the world. Vasculitis happens no matter where you live, no matter the geographic region. We have our largest group in the United States and in English-speaking populations, but we're working really hard to bring the network to all people, no matter where they are across the globe. As long as they have an internet connection, they can participate.
This is a current breakdown of the number of patients with different forms of vasculitis, and it pretty much correlates with the prevalence of the disease in the population that we're prevalent in those countries that you saw. And what you'll see, I think, is very important is we see have a lot of patients with GPA is the most common, and we have hundreds of patients with certain diseases, and maybe not as many with others. However, I think as we grew, we sort of felt from the beginning that once we have at least 100 patients with any disease, which we have now hit, that is a critical mass. And especially if those patients are active and provide data, then their voice and their data and their disease will be heard across our studies. Some of our studies go across all different forms of vasculitis. Some of them study particular types of vasculitis, and some look at particular manifestations or symptoms or problems in vasculitis. So we really need a mix. Everybody is important. We even have people who may not know what type of vasculitis they have that are participating. But you can see that we need, every patient counts, and the amount of data that we can get is only going to be a function of how many patients we have who are participating. This is just to show that we are, the Vasculitis Patient Powered Research Network is really a collaboration between the Vasculitis Foundation, which is your foundation and my foundation for advocating for patients with vasculitis, and the Vasculitis Clinical Research Consortium, which has been around for 20 years and conducts clinical research around the world. Some of the big trials you just heard about, those results were somewhat spearheaded from us, as well as other studies. And this is a combination. We also collaborate with other patient-powered research networks or similar type of research across other autoimmune diseases. And we've even created something called the Autoimmune Research Collaborative, or ARC, which allows us to work with other groups who are studying rare autoimmune diseases. And this power gives us, it will show you something in a second, allows us to answer and do research in different ways. And of course, all of this is because patients are engaged in the research that we do. We also look for funding from various sources. So this is, like many research operations, it's complicated, but the basis is patients providing data and us working together to advance research. So who are we? This is a list. This actually, what's nice about these lists are they're always out of date the minute we publish them, almost, because we have new studies and new things happening. What you will see here are familiar names, if you know the vasculitis world, and maybe not so familiar names. We have a very large group of investigators, and this is just the investigators. These are physician investigators who are studying vasculitis in various countries. And we have older, more experienced investigators such as me, and younger ones, and even those in training. And it's very important to have that spectrum. We have a nice variety of different investigators. More and more are joining us to do research. And that we think that's very important, that this resource be used by anyone who has a good idea.
Dr. Merkel, can you tell us what motivates researchers to study vasculitis?
Well, I think we've all got, well, I shouldn't say well, many of us got interested. These are both fascinating diseases clinically and from a scientific standpoint, but also the personal connections we have with patients. I know I have been inspired by my patients really every time I go to clinic and see patients, what they're dealing with and how they've overcome or worked with their disease, and the desire to find better treatments and better understand our disease. And those two things go completely together. The more we understand the disease, the science and the nature and the patterns, the better we can approach treatment. And I think it's also a very nice research community where we work together. So there's a lot that goes into being an investigator, and I'm glad that the VF and the VPPRN are able to support new investigators. Next, we have a list that maybe Dr. Gordon can talk about.
Sure, thank you. So this is a list of some of the patient partners that have worked with the research teams. One of the great things about this is that patients get to be involved in all components of the research study. These are, you may recognize some of the names from previous studies and also current studies that we'll be talking about. And the patient partners are a critical part of the research team, involved in every step of the research. It's a privilege to be able to contribute along with other patient partners in this endeavor. We get to form part of the community and work directly with the researchers and coordinators in doing this work. So we usually have at least one patient partner for every ongoing study, sometimes more than one. We'll put a call out when we have a new study coming up or we need partners, and you may have seen these announced in one of our recent newsletters, so please keep an eye out because we're always looking for people who want to contribute to our research endeavor.
I think you've answered one of the questions I was going to ask you is why do people become patient research partners? But maybe you can briefly say, once you've answered the call and we say you'd be a good partner, how hard is it to be a patient research partner, which is different from contributing your own data, which is also very important?
Yeah, so you need to use your critical thinking skills and attention to detail and ask a lot of why questions. I think it's important when patients are at the table, it reframes the discussion in the room and enables everybody to stay focused on doing things that are important to patients, that are important to researchers, that are important to clinicians, so we can all be focused on the goal, which is to improve the lives of people living with vasculitis.
I think that's a really good summary. And I think that as someone who's been working with patient partners directly on research for many years now, it has been fantastic and it really makes for better research. The other thing that we like to always emphasize is that there are different roles. Investigators and physicians, patients have different roles in our research groups. We're not trying to say that the patients should understand all the molecular biology, and we don't pretend to understand everything patients are going through. And it's really a combination, and that has worked well. The other key part of the other key leg of this three-legged stool are the staff members. And here you can see what is pretty remarkable is the relatively short list that we have. And that's because you can see Kaylin Larson was our first network manager, and now Christine Young. Karen McAleer is the project manager for the Vasculitis Clinical Research Consortium. Joyce Coleman is Joyce Coleman. Needs to say no more. She helps direct the Vasculitis Foundation. And Christina Burrows runs works with us through the Data Management Coordinating Center and does data. What is interesting about this is a network that has thousands of participants. We do dozens of studies and are publishing work on what is really a relatively small number of people who actually work to get things done. And that shows to the power and efficiency of doing this work through this registry. And that's one of the things that is different about this versus when we do clinical trials. When you have to come in, you come to our medical center and we do things. Those are good too, but this is a different way of doing research that's been very efficient and effective. So moving on to the actual research studies that we do, maybe Dr. Gordon can tell you, what does it mean to be a VPPRN research study? Yeah,
so there are two essential components. One is that ask a research question that is important to people affected by vasculitis, or the docs call this patient-centered research. Again, this helps us to prioritize answering questions not only that are clinically relevant or of interest to the researcher, but how does that relate to a priority for those of us living with vasculitis? And the second is that it must have significant patient engagement. There must be a plan to engage the patient and use a patient's patient voice in every part of the research program.
And here are some recent VPRN studies which have either completely completed or have completed recruitment under analysis. And I think what's interesting here is there's really quite a wide impact. We have this study we did some time ago on the impact on vasculitis on employment and income called VASWork. We like to have good nicknames for studies. There's a study on skin vasculitis for anyone who's had vasculitis of the skin. That study has completed data collection, is now getting written up into a paper, and the analysis is complete. We have this diagnostic validation studies ongoing, which actually these are studies to try to show that the patients who say they have whatever disease actually have it, and that we've published and we're showing, and that's been really quite reassuring that our data are very strong. We have the Vasculitis COVID project, which is in multiple different publications and things have come out. And this was a collaboration with other patient groups. Quite honestly, when the pandemic started, all of us, patients and physicians, all we were thinking about was the pandemic and COVID-19. And we pivoted our research quickly to think, how can we better understand the impact of this virus, this pandemic, what's happening scientifically, medically, and in society on our patients. And we were successfully able to do that. And this study called Healthy Minds, Healthy You was an interesting clinical trial of mindfulness. I'm going to stop and say, because I'm pretty confident that Dr. Gordon was involved in all of these as either actively or as a participant by giving her data. Do you want to speak to some of these?
Yeah, I did participate in all of these. Most of these are done online as surveys. So many of you may recognize them, or at least recognize the names that we come up with. There are a lot of publications associated with these projects that don't have the exact name in them. So sometimes it's a little hard to map when you see a publication come out from the network where that's, where that data came from. So you may have been involved in a number of the studies that we're going to talk about in a few minutes. But I really enjoyed the VASC work and the COVID-19 project in particular. I thought that they were really interesting, and they got me thinking myself about how I was working with vasculitis and what the impact of my work environment and the COVID pandemic were personally, and to see what patients and my colleagues thought of that.
I also know we have I've completely forgotten. I know we have a poll question coming up. Maybe we'll finish this next slide first. So these are current studies and future studies that are going on, and maybe we can go back and forth. The first one is our big cohort studies, where we're basically following you all with different diseases. Jen, do you want to speak to these and why these are so important?
Yeah, I'm involved in the EGPA registry because I have EGPA. But what we find out about a particular form of vasculitis is important for understanding other forms of vasculitis, comparing and contrasting. The VASC Strong study, I think, is wrapping up right now. I really like the name of that one. That's a really powerful study to consider. And I'm looking forward to the sleep study. One of the things that I think patients really find impactful is, fatigue and pain and all these other things, and sleep is directly related to that. So we know there's a lot of interest in the sleep study in particular. But Dr. Merkel, can you tell us a little bit about which types of vasculitis are involved in these studies, and particularly for those who might have the more rare forms of vasculitis, how they can participate?
Well, that's correct. So you can definitely participate. So we follow everybody in the registry over time, and those data are collected, and we've used them for different studies. I can tell you that every form of vasculitis has been represented in some of our studies. Actually, many of our studies cut across different forms of vasculitis. Some are very specific for a particular type of vasculitis. Some are particular for a group of vasculitis, such as the ANCA-associated ones, GPA, MPA, and EGPA, or large vessel, which would be GCA and Takayasu, and some are across all of them. Of these, the first one here, the cohorts are with everybody. Vasculitis Pregnancy Registry, which we are very eager to continue. We have pushed this for years. This is exactly what it sounds like. We follow women when they're pregnant, women who have vasculitis, and this is an important study. We really need more information about this, and this is the best way to do it, directly from the people who are pregnant and have vasculitis. And we actually have translated this into multiple languages, and we're getting participants from around the world. This predictive analytics project I'll tell you more about, because this stemmed from a first project we did, which gave us the data to then apply for a very large grant from the government, which we have. And this is allowing us to do some very sophisticated analysis. Neurologic involvement is in ANCA-associated vasculitis. This is an example of just 3 of the diseases, while the sleep study would be an example across all the diseases. And we're excited about working on trying to launch a pediatric registry. Children can participate, but we're going to actually focus on children in this sub-branch of the VPPRN, and that's being led by some pediatric rheumatologists. And similarly, we're looking across the lifespan of people with different forms of vasculitis. So lots going on. Maybe we should throw the poll question up now.
Sure, sounds good.
So this is a simple question. Are you a member of the VPPRN? You get to choose one answer, please. Okay, wow, this is great. So 63% of you are members of the VPPRN. 15% of you are not. 13% no, but you're interested. Well, you come to the right place. We're about to tell you how you can join. And some of you are not sure. We'll follow up with you. Jen, do you want to make any comments as well? And what can we do to swing those no's back to yes?
Yeah, hopefully we will convince you by the end of this, by the end of the presentation here. We're going to go through some examples now of the research in action and how you can learn more about what the outcome is from the research studies and what it would mean to patients.
And I think it's also interesting that so many people who are now up and engaged on a Saturday in this are part of the Vasculitis Patient Powered Research Network. I think it shows how engaged our patients in the network are, who are also engaged in the work of the Vasculitis Foundation. We want to just remind you that I think following this talk, it might be a few minutes late, that Michael Putman, a young investigator that we work with, is going to give you a guided tour of some of the posters that were presented at the Vasculitis workshop in Dublin. And all you have to do is stay on this link, and you will magically be able to hear him present some interesting research that you will learn, that you participated in, and that affects you. So let's go through a few of the publications that involve the data that we collect from you. And this is what publications are very important, because without them, no one can see the data in a formal fashion. And they're also important to our investigators and our patients to have it out there. So I think I'm starting with this one. This was a study we did some time ago. We called this Journey study. And this was looking at how long did it take for you to be diagnosed with vasculitis, and what led to that delay? Because we had a real sense that just seeing patients, that the delay in diagnosis can be significant and problematic. And what we were unfortunately able to show is that we were right, is that there's a very significant delay in some patients. Some patients get incredibly sick, come to the hospital, and are diagnosed in 3 days. But some patients, months or even years, it takes, sorry about the background noise. We have, it sometimes takes that long to get diagnosed, and we need to work on making sure that physicians and patients can understand that vasculitis needs to be thought about earlier. And this actually has stimulated another one of our projects to try to figure out, how can we automate this system? Can we learn from all those data that your doctor is typing in when he or she sees you? What could that tell somebody earlier that this patient may have vasculitis? So this led to an important new study as well.
This is another recent study on COVID-19. So I was a study participant and filled out the surveys, but I'm also a member of the research team. And as a member of the research team, I'm one of the authors on the publication, which is really a great thing, that patient partners can contribute fully and be recognized for their contributions to the work. So all of us are, of course, concerned about COVID-19, and particularly what happens to those of us living with vasculitis. So this is one of the many studies that we have conducted and are still conducting on the impact of COVID-19 on those of us. If we go to the next slide, this is an early snapshot of some of the results from earlier in the pandemic, measuring the level of concern of patients about COVID-19 and access to healthcare and telemedicine visits. We've done some follow-ups, and we will continue to follow up to find out how patients are impacted in terms of choices of medication, concerns about traveling and other things like that. This has really given us a chance to get feedback from the community in real time, because it's been happening so quickly, about what are the biggest concerns to patients. And that also gives the VF and the VPPRN an opportunity, when we're planning webinars and things like that, to answer the questions that are most important to those of us with these concerns. And I think the VF is planning a follow-up webinar soon with some updates on COVID-19. So please look for that coming up.
I'll just add briefly, I don't think you mentioned, this paper itself was actually, we were told this was one of the top 10 clicked on papers for this journal. This is an important journal from the American College of Rheumatology, which I think really speaks to the fact that it's not just patients, but it's the readers of this journal, which mostly physicians, both those who do research, but also practicing physicians. So I think we have been able to publish work that has impacted the field, and that's been terrific. I think we're going to pick up the pace a little bit. So I'll just tell you pretty briefly about this study. This was the validation of the ANC-associated vasculitis patient-reported outcome AAV Pro. So what does that mean? We spent actually about 5 years developing with Dr. Jo Robson up at the upper left. She led this, a as the senior person on this. We had patient partners you can see right here as well who were part of this. This was a study to understand how to measure the impact of vasculitis on patients from the patient perspective. This is actually a complicated science to do this. We were able to develop this questionnaire that is now being used in clinical trials. And I won't go through all of the data here, but to say that through the VPPRN, we were able to do some important, what we call validation, to show how reliable this was. And this was important, and it allowed us to get to the point where this is now an accepted measure that we're being used. So let's talk about how you can participate in research. Many of you are already doing it, but we're hoping that many people will view this video and also be encouraged to join. So we're going to move a little quicker, but Dr. Gordon, let's go.
Yeah, I just want to emphasize that but taking part in the VPPRN, we're contributing our data. This is a patient community, and this data is used to do research. I want to thank the doctors on the call today. Our clinicians are working night and day, and you see here they are spending their Saturday morning. This is what we can do to help them. We benefit from the research. We want to make sure that we're a strong community and we're contributing our data so we can learn all about the different types of vasculitis and how we can help each other to improve lives for all of us. And a very easy way to do this is to join the network and contribute your data. Because with this data, we can do the kinds of studies that you heard earlier in the previous session and that you're going to hear in the Research in Action poster sessions and that Dr. Merkel and I highlighted just a few minutes ago. So there's so many exciting things going on with the network, but we really can't do it without patient data.
So we need you, Christine.
Yes. Yeah, so let's talk about biannual forms. So this is very near and dear to my heart. So biannual forms. So as a member of the Vasculitis Patient Powered Research Network, we like to check in with our members biannually, January and July, and ask our members to tell us how they're doing. So tell us about any disease flares, tell us about your vasculitis symptoms, tell us how you're feeling, tell us about any changes to your medication. And this information is very valuable. We collect it because we use it for our research studies and we use it to build databases for future studies as well. Patient data drives research, and the more data we have, the more answers we can find. So as you can see here, the biannual forms are actually out, and coincidentally, timely, they were released or they rolled out yesterday. So you would likely have heard from me or an email. You received a notification about the release of the biannual forms, and hopefully most or some of you who are VPPRN members have already gone in and completed the forms. But if not, there's a URL here as well and a handy dandy QR code for you to use as well, and it'll bring you right to the login page for the VPPRN.
And Christine, how long does it take the average patient to complete these forms?
It takes about 10 minutes.
I heard it could even be quicker.
Yes.
For those of you who may be joining for the first time, the baseline forms, we call them, are a little longer, but that's probably no more than 20 minutes total. Once you've done that, 10 minutes every 6 months, we don't think it's too much to ask to be able to provide really important data. I cannot emphasize enough how important it is to have these data and not to have missing data. So please just spend the 10 minutes and give it to us. We really appreciate it. And
so there's a special incentive that we have. So this is new for this cycle. We are offering, so if you complete your forms by September 15th, you have the opportunity to win a gift card. So there's actually two opportunities. So if you are the first 50 individuals who complete the forms, you'll be eligible for a $100 gift card, Amazon gift card. But we'll select other individuals who complete the forms by September 15th, and they'll be eligible for a $50 gift card. So we want to make sure that you help us power research by completing your biannual forms, and then hopefully you'll see a little prize at the very end as well. But at this time, we also
mentioned the prize and
yes.
pride of participating in research. I don't know if Jen wants to make a comment as well.
Yes, it's the long game, right? But that's what we're all after, doing the research.
So actually, if we go back to the other slide, the previous slide, we actually want to take a poll and see who has actually completed the binomial forms already. And it's a very interesting, we want to see the results for that. And I'm hoping a lot of people are going to answer, yes, I'm a research rock star. So I'm hoping we're going to get a high percentage for that response.
Although, as in all research, we seek the truth. So just have you completed your forms? Yes, not yet, but I'm going to be, or no, not a member yet.
We had a question in the chat. Can caregivers participate on behalf of the patient?
Yes, they can. We ask you to indicate that you're a caregiver on behalf of the patient, but absolutely.
We had another question asking what if your specific vasculitis diagnosis is not yet confirmed?
Well, that's an interesting question. You fill out your data to the best of your ability, and you may say, I'm not sure what type of vasculitis I have, and we have a category for that we'll look at. So this is interesting. So so I would say, I'm not going to say only, I think the glass is pretty full. 27 out of 71 people who I guess could be completed, have filled it out. So 27 people have filled it out. 23 are going to, I hope, today, right? You're going to fill it out today. And the other ones haven't filled it out yet because they're not yet members, but I'm sure they're going to join. Don't you think, Dr. Gordon? Don't you think they'll join now?
Yes, absolutely.
It's really not hard, and it's really, really important. So for those 23 people, please complete them this weekend. Better yet, do it as soon as you finish this webinar. Write yourself a little note and do it. I think we made this point. So, so this is, again, you can just put your phone up to this, but I think there's many ways to join and many ways to complete your forms, which are really important.
And if you're thinking about joining and you're not sure, please stay on for the research and action poster session where you can see the actual results from our data put into the registry and how that's used to benefit those of us living with vasculitis.
And we highlighted a few of the studies, but there are actually many others that have been done as well. It's really quite remarkable how we've been able to do research in this manner. So here are your contacts. Christine Young, you've now met. Her number's available, and you can also find all of this information on the website. You can write to her through the support or through her email at Penn Medicine. Lots of ways to find Christine, trust me. I think we're done.
Great. Well, at this time, I'd like to thank all three of you for participating and speaking today and sharing about the VPPRN. It's so critically important to all of us.